If you're no longer satisfied with your smile due to tooth decay, gum disease, or missing teeth, spring is in the air and there's no time like the present to give yourself the gift of vibrancy. Dr. Andrea Joy Smith is helping her patients smile again now with mini dental implants, and she's here today to share those details. Hello, Dr. Andrea Joy Smith.
Hello, Desiree. Pleasure to be here as usual.
Yeah, we're always happy to have you on. So, Dr. Smith, dental implants seem to be a procedure that can benefit patients who have loose dentures. How long have dental implants been in widespread use?
Dental implants have been in widespread use since the early 70s, maybe even the late 60s. And yes, for patients that have missing teeth, they have been this go-to solution for a lot of years, whereas we used to have to do a bridge by using two adjacent teeth to to give them back that missing tooth. But with our patients but for our patients with loose dentures, there hasn't been many solutions that have been affordable. So with mini dental implants, we can place four very small implants into the bone and snap those dentures into place, and the loose dentures can be a thing of the past.
Oh, wow. So we can really see the difference there. And let's show some before and after photos. We're going to put up a few on the screen and then walk us through kind of what we're seeing, what was happening before and what's happening after.
Right. When this young man came in, he had a partial denture. He had just a lot of crown and bridge work and just several teeth that were no longer restorable. And he was about to make a major life change. He was going to retire. He was getting his new car shipped from Germany, and he wanted his smile to go with his new car. And he also was thinking about getting married. And so he came in, and he had been told by many offices that he just simply did not have enough bone to support teeth. And so he read about me or saw me on television, and he did not have a lot of bone, but luckily we had implants that would fit his bone. A lot of times with conventional implants, we're looking for the doctors are looking to make the bone fit the implant, which is usually a large implant. So there's a lot of bone grafting and other surgeries that are required. But with this particular young man and with many other people, we actually have an implant that'll fit your bone without having to do surgery to stretch your bone to fit a conventional implant.
Wow, so he was able to get that new car, Dr. Smith, and you gave him that new smile. That's exciting, and I'm sure a great time for him. Are all dental implants the same? And if not, what makes mini dental implants different?
Yeah, many dental implants are different because they are simply less invasive. They are a one-piece unit, which means that on the same day that I place the implant, either the crown or the bridge that's going to go in can be placed the very same day. Now, often it's a temporary crown and bridge because before the implant goes in, we cannot really have an exact location of the implant, but we can have temporaries made ahead of time that will allow teeth to go in right away. And then we can take the final impression or scan for the lab to make the final restoration. Unlike the normal conventional implants, they're normally two pieces. So the first part is a surgery where the implant is embedded into the bone and then covered by the soft tissue. And then a few months later, it's uncovered so that it can then be used for a crown or to stabilize dentures or whatever the use is going to be. So that really sets it apart. Patients can come in with a loose denture today, and by the time they leave the visit, that denture is snapping into place and is not very loose and able to move around at all.
Yeah, and we were looking at one of the before and after photos, seeing someone get that loose denture replaced. And we also have a video of a very happy patient after receiving dental implant treatment. Let's take a look.
I just want to thank Dr. Andrea Joy Smith for giving me my smile. I have not had nice teeth or a straight smile since I probably was in third, fourth, fifth grade. I was so self-conscious about my teeth. But because of her treatment and her procedures, I now can smile. I'm proud of myself, and I encourage anybody to overcome your fears and come and see her and put your life back on track as it pertains to your dentistry.
Wow, you really boosted her confidence. How does it feel to hear one of those testimonials, Dr. Smith?
You know, it feels really amazing. You know, I've been practicing dentistry for nearly 30 years. And for the last 15, I have been treating patients just like her. And it really does my heart good that we can make such a life-changing difference in someone's life, because it really and truly is life-changing.
And how long have you offered mini dental implants and these life-changing treatments to your patients?
Well, for the last 15 years, I've been placing these small diameter one-piece implants. And I have to say, I've changed hundreds if not thousands of smiles, actually. I've placed well over 7 or 8 thousand of these mini dental implants. And a lot of times I'm placing multiple inside one patient. But I do single teeth, multiple missing teeth for bridges or single crowns. And it's very little in dentistry is more rewarding. Let's just put it this way. No one's ever been so happy when I just finished a root canal.
Oh, there we go. I like that. So go and get your mini dental implants. Dr. Andrea Joy Smith, always a pleasure having you on. And you can get your pearly whites at an affordable price and visit smileagainnow.com.